There we go. Okay. Some of the resulting factors regarding behavioral changes can cause in family members, right? Loss of trust, emotional instability, and safety concerns. Jen, I think I got it up here. We're good. And I think everybody that has ever been exposed to somebody who has an addiction knows, whether it's opioids or alcohol or even, I mean, gambling is a major one for a lot of folks, that there's a loss of trust that immediately happens between that individual and the family. And so it's how do we rebuild those relationships with the folks. Again, that emotional roller coaster that family members ride through that process. And ultimately, there are, from a DHS perspective, major safety concerns, right? When we're looking at child welfare, or even in our adult protective service sometimes, right? Adult children who are caring for their elderly parents or aging parents who may have an opioid addiction and they don't even realize they have that because it's prescription drugs that a medical provider has given to them. But there can be an abuse of those medications if they're not careful. Some of the significant impacts behavioral changes can cause conflict arguments, right? Difficulty communicating. I think we see that a lot in our child welfare system here, is that we continually see families that have a very difficult time, one, communicating the trauma that they've experienced, right? Our parents who we're involved with in child protective services do not use because it's just something to do. It's because they have not dealt with the trauma that they've endured as a youth and into their adulthood that has impacted this process. And so we really look at what can we do to help build that communication bridge back in so that folks don't feel that there's that break with whoever is using, with services, with whatever we're providing to them. So how are we, as a department, addressing and helping families overcome this? So on the behavioral end, utilizing in-house mental health services. We've talked a lot about the very sparse amount of mental health providers within our area, but I think its reality is across the entire state. And one of the issues that we had in our department was finding adequate behavioral health to meet some of the safety and therapeutic services that were needed to get to reunification between parents and children. And so in 2022, we onboarded a full-time mental health provider. In 2026, we plan to add a secondary provider to assist with the volume that we have in-house. That gives us an opportunity to begin to break down that stigma of whether or not it's the family, the individual, the children, that they're going somewhere that, you know, let's be honest, human services, social services, comes with a stigma. People don't want to come into our office because they're afraid of what the public that drive by would say. So our mental health services are not housed in our department, but we do offer them to our child protective and adult services so that we can make sure we can get in front of intervention as quickly as possible. We also, in our adult world, work with long-term support services. We are the case management agency for both Huerfano and Los Animas County. We provide Medicaid waiver services for long-term in-home health care, nursing facility, and other placement facilities. And so that's a really important piece too for somebody who is, let's say, aging and they might have an opioid addiction. Families are really struggling to care for the alien parent or the family member. They're not even alien. We do provide services for IDD, anywhere from 18 on up, but ultimately that has a major impact to the families. And so through long-term support services, we're able to put somebody who's qualified and certified to be in the home to help assist those families. One of the other things that we're doing, and I know Jamie Tupper, my supervisor for our Division of Youth and Family Services, is going to speak this afternoon. I'm sure she'll talk a little bit about baby court, so I won't go into too much of that. But we are initiating that process with the state in our judicial system. We hope to have that up and running in 2026. And I'll let her explain a little bit more of how that works this afternoon, but I think it's one of the better moves that we can make to help support the families and the babies that we have in our Child Protective Services. And just to kind of give you a statistic of how impactful it is, and Jamie, you might correct me on this, but in the 18 months that Jamie's been with us as supervisor, we have taken custody of seven infants born addicted to substances. In our area, that is a significant number. That is a significant data point that we are trying to lessen as we move forward as an agency. Financial, financial, again, we talked about security. We offer supplemental nutrition assistance programming, temporary assistance for needy families, or TANF programming. Those types of programs allow our families who are struggling, if they qualify, to not only have access to food, but also can provide them with monthly financial stipends if they're unable to work. Allow them to access other services such as educational opportunities. We do offer, through our Colorado Works program, guidance into either a GED program or into a certification program for TSC, or even beyond. And we also work really closely with our workforce center, and we onboarded a workforce development coordinator to help support families, both in the child protective and our general public, but also in our child support division, our non-custodial parents. So we're really trying to engage and get people gainfully employed again as part of services we provide. And then, of course, we work with a ton of community partners throughout the area, including Crossroads, LACRC, Keep Trinidad Safe, the health department, the judicial system. Those folks are key to the success that we have with our clients that we serve every day. Emotional impact, some of the things that we've changed to our practice, the biggest one that we've done this year, I want to give my DYFS team congratulatory measures for their efforts to switch our Child Protective Service approach to a process called differential response. And I'll let Jamie talk a little bit about that this afternoon too. But I think this was a huge shift for the way that we look at Child Protective Services, how we interact with families. And what we're seeing through the process that we've already started is that we're less involved in removing children from the home. We're really doing a lot of heavy safety planning around keeping children with their parents. And we have better success in reunification through that process. We're not going to termination of parental rights. We're not reaching permanency in what I think would be the more traditional Child Protective Service method. And it also reduces recidivism, or it increases success and reduces recidivism in CPS cases where we're not going out multiple times with the same family. We've already seen families that have been successful, and we're seeing them flourish. We're not having to intervene or do prevention services and family with them. Again, we talked about generational trauma. And so one of the things that we're trying to do is break that cycle. Again, children may witness unhealthy coping mechanisms and behaviors leading to potential substance use of their own. So we're trying to get in front of that, especially in our truancy court. And I know Liz is here, Judge McKisson's here, thank you guys, Marty's here from probation. But this is a big thing in this community. We have extremely high truancy rates throughout. We have a lot of kiddos that are using substances daily. We saw that data point yesterday. Those are self-reported data points. That is scary that we have that many youth in that age group that are admitting to using substances this early on in this county. That's all I got, so I will take just a few seconds for questions, and then if not, we'll move to the next presenter this morning. Okay, I will shut it up now, and I'll